Good afternoon. My name is Stephanie Schmidt, a Senior Policy Analyst on the Child Care and Early Education team at the Center for Law and Social Policy, or CLASP. I would like to welcome you all to CLASP and diversitydatakids.org webinar today titled Place and Race Matter, Head Start and CCDBG Access by Race, Ethnicity, and Location. CLASP is a nonprofit anti-poverty organization that advocates for public policies that reduce poverty, improve the lives of poor people, and create ladders to economic security for all, regardless of race, gender, or geography. We target large-scale opportunities to reform federal and state programs, funding, and service systems, then work on the ground for effective implementation. DiversityDataKids.org is a national indicator and policy research project dedicated to tracking progress towards greater racial, ethnic equity and well-being for children in the U.S. The project maintains a state-of-the-art website, conducts equity-focused research, and engages in a variety of dissemination, outreach, and user engagement and partnership activities. The overarching objective of the project is to inject actionable equity-focused data, analysis, and research evidence into the narratives and policy decisions that affect U.S. children from the national to the neighborhood level. We would like to thank our generous donor, the Annie E. Casey Foundation, for making this webinar possible. Before we begin, I would like to quickly mention some housekeeping items regarding what you can expect over the duration of the webinar, which is 1 hour. As you joined the webinar, your phone lines were automatically muted and will remain muted for the duration of this webinar. We'll save time at the end of the webinar to take some questions from the audience. To submit questions, please send them in via the chat box. You can also let us know about technical issues you're experiencing through the chat box. The presentation and recording will be available after the webinar on our website, www.clasp.org, and on diversitydatakids.org. Next slide. Here's an overview of our webinar today. I will be starting with an introduction to who the young children are, including some data on race, ethnicity, and poverty. Next, I will provide an overview of the Head Start preschool and early Head Start findings from the report, Disparate Access, and then I will present on the CCDBG findings. We will then hear from our two colleagues at diversitydatakids.org. Dolores Acevedo Garcia is the Professor of Human Development and Social Policy and Director of the Institute for Child, Youth, and Family Policy at the Heller School for Social Policy and Management at Brandeis University in Massachusetts. She is the Principal Investigator of the diversitydatakids.org project. Erin Hardy is also at Brandeis University. She is a fellow at the Institute for Child, Youth, and Family Policy at the Heller School and serves as research director for the diversitydatakids.org project. And last, but certainly not least, Sylvia Puente, Executive Director of the Latino Policy Forum, will respond to the findings of these two reports and share thoughts on recommendations and next steps. Thank you, Sylvia, for being with us today. We also plan to leave some time at the end for questions, so please remember to send us your questions via the chat box. Next slide. And now we'll turn to look at the diversity of the young children in the United States. Young children in the U.S. are, as a group, diverse in race and ethnicity. Children born in recent years have been majority minority, as racial and ethnic minorities now make up half of the young child population, with young children defined as birth through age 5. It is estimated that the tipping point to a majority-minority population for children under age 18 will happen in less than 5 years. An analysis of census data shows that 50% of young children were white, non-Hispanic, or Latino, and 14% were African American or Black, non-Hispanic, or Latino. 1/4, or 26%, were Hispanic or Latino, regardless of race. Finally, 4% were Asian, and 1% were American Indian, Alaska Native. Next slide. It is also important to note that young children are most likely of any age group to be poor, which research shows is a strong predictor of children's success in school and of adult employment and earnings. In 2014, 24% of young children were poor or living in families at or below 100% of the federal poverty level. These data also show that a disproportionate number of young minority children were poor. Black children experienced the highest poverty rate of any race or ethnic group at 43%. While children growing up in poverty experience poorer health, higher incidence of developmental delays and learning disabilities, and greater hunger compared to their peers, high-quality early care and education programs can play a critical role in the healthy development of young children, particularly those from low-income households. With children of color being overrepresented among poor children, it is important to look at the level of access young children of color have to early childhood care and education opportunities. Next slide. In the first part of today's webinar, we'll be discussing findings from CLASP's Disparate Access Brief regarding children's access to Head Start Preschool, Early Head Start, and the Child Care and Development Block Grant, or CCDBG, as well as have a discussion on how to understand the data. You can access the full report as well as view the state-by-state findings and our methodology at the link on the screen. Next slide. Now that we're grounded in some of the data on young children more generally, we'll turn to the methodology and findings from this report. This brief offers state-by-state estimates of racial and ethnic differences in the share of eligible children who participate in Head Start Preschool, Early Head Start, and CCDBG. I'll first be focusing on the Head Start findings. Please note that we calculated participation rates by comparing the number of children in Head Start or CCDBG to the number of eligible children based on administrative data and data from the American Community Survey. The findings are based on 3 years of data from 2011 to 2013. I also want to mention that this brief looks only at Black, Hispanic and Latino, Asian, and American Indian Alaska Native populations due to limitations in the data. Because the Head Start and CCDBG administrative data report race and ethnicity separately, it was not possible to identify which children were white, non-Hispanic, or Latino. Therefore, white children are not included in this analysis. Further, because of sample size issues, some race categories had too few children to analyze in particular states. Next slide. In order to best understand the data we are about to present, it is important to understand the context in which Head Start programs are administered, as well as the eligibility parameters of the program. As many of you know, Head Start programs are administered through a federal to local grantee funding stream, except for in those instances that a few states are themselves early Head Start grantees. Therefore, assessing the data on participation in Head Start in each state is not an indicator of state policy choices, but more provides a state-by-state look at federal investments. In this report, we looked specifically at access to Early Head Start in the Head Start Preschool program. Early Head Start serves children birth through age 2, and Head Start Preschool serves children ages 3 and 4. Early Head Start also serves pregnant women, but this report is limited to the data on children. Head Start eligibility is based on poverty status. Therefore, eligibility in this analysis was limited to young children living in households below the federal poverty line. Because we modeled eligibility based solely on the poverty level, these findings should be considered estimates and not exact. Programs are also allowed to enroll children above the poverty level and for categorical eligibility reasons. Our analysis does not include data on children served in the migrant and seasonal programs or the American Indian Alaska Native programs due to the complex eligibility criteria for these programs. Next slide. Furthermore, it is important to know that the overall makeup of the Head Start program is diverse. 38% of all Head Start children are Hispanic, regardless of race. 29% are African American or Black. Almost 1 in 10 children identify as biracial or multiracial, and 12% identify as an unspecified or other race. While 43% of children were white, again, it is important to remember that it is not possible to identify white, non-Hispanic or Latino children from the white, Hispanic or Latino children due to the way the data was collected. Next slide. And now to the findings from the report. Fewer than half of all eligible children, those with incomes under the federal poverty level, were served in Head Start Preschool nationally. About 54% of eligible Black preschoolers were served in Head Start Preschool, as were 38% of eligible Hispanic or Latino children and 36% of eligible Asian children. Please note that additional children birth to age 5 are also receiving migrant and seasonal Head Start services, the vast majority of which are Hispanic or Latino. Therefore, a greater share of poor Latino children have access to Head Start services than is shown here, which would narrow the gap in access between Black and Latino children. Next slide. At the state level, the differences in access to the Head Start Preschool program are striking. To see the state-by-state percentages for all children and each race and ethnicity, please consult Appendix 2 of the Disparate Access Brief. Next slide. Turning now to early Head Start findings. According to our analysis, just 5% of eligible children were served in the Early Head Start program nationally. The percentages of eligible children served were low across the board for all races and ethnicities. 6% of Black infants and toddlers, 5% of Hispanic or Latino infants and toddlers, and 4% of Asian infants and toddlers. As with Head Start preschool, there are differences across states in the share of children served by race and ethnicity in Early Head Start. However, the main takeaway for Early Head Start is that access, regardless of race and ethnicity, is universally low. 6 states served only 4%, the lowest percentage across all states. To see the state-by-state percentages for all children in each race and ethnicity, please consult Appendix 3 of the Disparate Access Brief. Next slide. Now let's take a look at the access findings from CCDBG. Next slide. As was mentioned earlier, in order to best understand the data we are about to present, it is important to understand the context in which CCDBG programs are administered, as well as the eligibility parameters for the program. CCDBG is the largest source of federal funding for childcare in the country. Unlike Head Start, CCDBG's funding structure is federal to state, meaning that the dollars allocated for the program travel from the federal government to the state. The state then administers the program by designing the policies that the programs must follow within the federal parameters of the law. States have significant discretion in creating these policies, and they vary significantly by state. One of those policies is eligibility. States can set the income eligibility limit at whatever they wish, so long as below the federal parameter of 85% of state median income. Many states set their eligibility far below that, and there is a significant range from state to state. For purposes of this paper, 175% of the federal poverty level was used to determine who was eligible. This was chosen as it was the median income eligibility limit across all states at the time of the analysis. As such, the percentages of access you will see in the slides following this actually understate the need for child care assistance among all children that could be eligible according to the federal parameters. Another policy that states have discretion over is the work and education requirements that parents must be doing in order to receive the subsidy for their children. For purposes of this paper and because of data limitations, only work requirements were considered. In order to be considered eligible for purposes of this analysis, both parents in a 2-parent family must be working, or the only parent in a single-parent family must be working. Our analysis only looked at CCDBG-funded child care. This means that children receiving child care that is funded directly through TANF are not included in this analysis. In 2014, 1.4 million children were served through the CCDBG funds alone. Next slide. So let's take a quick look at the racial and ethnic makeup of those 1.4 million children being served in CCDBG. 21% of all children served in CCDBG are Hispanic, regardless of race. 42% are African American or Black. While 41% of children were white, it was not possible to identify white non-Hispanic or Latino children from the white Hispanic or Latino children due to the way the data was collected. Next slide. According to CLASP analysis, 13% of eligible children were served in CCDBG nationally based on income eligibility at 175% of poverty. Access for most racial and ethnic groups is low, ranging from 6 to 21% of eligible children being served. Nationally, CCDBG served about 21% of eligible Black children, 11% of eligible Asian children, 8% of eligible Hispanic or Latino children, and 6% of eligible American Indian Alaska Native children. You will see that for all groups besides Black, the share of children served is below the national average. Additionally, the share of Hispanic Latino children and American Indian Alaska Native children served are nearly half that of all children and 1/3 of the percent of Black children served. Next slide. For CCDBG, there are considerable differences by state in the share of eligible children served by race and ethnicity. As a reminder, to see all states access to race and all states access by race and ethnicity, visit the appendices of the full paper. Next slide. This map shows the significant variation in access, but also the very low levels for Hispanic and Latino children. The very light pink color that you see in the southeast and northwest shows pockets of incredibly disparate access with ranges from 0 to 5% in these states. The slightly darker pink that you see on the largest proportion of states shows access on par with the national average of 8%, with access ranging from 5 to 10% in these states. The very darkest red color that you see in the Northeast, New Mexico, and Alaska indicate states with the highest access, but even the highest access only range from 15% to 20%. 29 states of the 47 we were able to calculate had access below the national average of 8%. Next slide. To learn more about Latino access to CCDBG, you can read our new brief, A Closer Look at Latino Access to Childcare Subsidies, which was just released yesterday and can be accessed at the web link on the screen. This new brief is a companion piece to our original report discussed today. This brief elaborates on the low level of access Latino children have to childcare assistance through CCDBG. Next slide. And now that I've presented the data points, I want to take a few moments to talk about the potential reasons that access to both Head Start and CCDBG is low and disparate for children across the country. Next slide. While this analysis alone cannot determine causation for disparate rates of access, we can offer some possible explanation and hypotheses. Federal funding has not kept pace with changing demographics. Over time, where low-income children live has changed geographically, yet historic patterns of funding have not kept up with demographic shifts. Because federal Head Start and CCDBG funding has only achieved relatively small gains in recent years, and because the formula funding reflects past state allotments, areas with new populations in need tend not to get additional resources except when there is an expansion of funding. Thus, states with growing populations of eligible children will be less able to serve them. While the federal government provides the bulk of funding for Head Start and CCDBG services, increased state investments to expand the number of children accessing Head Start services and child care assistance could also result in a higher share of eligible children served and potentially reduce disparities across groups. This analysis also shows us that targeted programs to increase access for specific populations work. Access to early childhood services for a particular population can be improved when there is a commitment and dedication of resources. From its inception, Head Start has worked to ensure access to groups of especially vulnerable children. Additionally, Head Start has built-in standards that relate to access, including things like community needs assessments or the fact that they're grounded in the local community, as well as program standards that really address children's culture and language. And these influence the program's ability to reach minority communities. State CCDBG policies impact who accesses care. Because of the large number of state policies that impact access to subsidies, it is possible that particular groups of children are more or less likely to obtain child care assistance based on state policy choices. For example, particular state eligibility practices may make it difficult for families with highly variable hours of employment to participate. To the extent that this is a characteristic of employment patterns of Hispanic and Latino families, such policies may disproportionately impact Latino children. Additionally, state discretion has resulted in uneven access across states and a range of policies that may impact some communities differently. Next slide. Data findings in this paper suggest a number of potential next steps to improve available data, better understand the causes of differential access, and ultimately improve access to child care and early education for all children, regardless of race or ethnicity. While the data cannot reveal precisely why differences in access exist, they can help inform further exploration, research, and advocacy to identify barriers to access and solutions for underserved groups. A first step is greater investment at all levels of government. Additional investments are crucial to reducing barriers to access for racial and ethnic minorities. As outlined earlier, current federal and state investments severely limit access to high-quality child care and early education for many children. And for some groups of children in particular states, access is extremely limited. Improved data collection and reporting on both access and quality of programs would inform our understanding of how diverse groups of children experience differential access to Head Start and CCDBG. In CCDBG, states play a large role in determining who gets access to subsidies and the quality of child care that can be accessed, which makes assessing state policies for their impact on communities of color very important. Taking a closer look at patterns of state policy and funding choices within the child care subsidy program to identify state-level policies that restrict or expand access for children is necessary to further understand the disparities that result. While not all services should necessarily be targeted, intentionally reaching underserved populations may be a successful strategy that emerges from Head Start's history of targeting resources. In CCDBG, states can consider the use of contracted slots for child care services in particular communities to increase access for underserved populations. It is important for early care and education stakeholders to build relationships and partner with organizations that serve and represent racial, ethnic, and immigrant families. The early childhood, civil rights, and immigrant rights communities often operate independently of one another. Formal and informal collaborations can take many forms and offer an opportunity for stakeholders to share the knowledge, garner new ideas, and discuss how data can be used as a tool for addressing racial inequities. As a reminder, if you have questions, please submit them via the chat box. And with that, I'll turn it over to Dolores and Aaron with diversitydatakits.org.
Thank you, Stephanie. Hello, I'm Dolores Acevedo Garcia, Project Director of diversitydatakits.org. My colleague Erin Hardin and I will be presenting the results of analysis we are doing looking at patterns of neighborhood access to Head Start and how access differs by race, ethnicity, and nativity. By nativity, we mean whether children live in an immigrant family, that is, in a family in which at least one parent is foreign-born. Stephanie and CLASP's work have established that many children who are eligible for Head Start are not served by the program. They have also established that there are racial and ethnic disparities in participation in Head Start among children that in principle should have an equal chance because they are all eligible on the basis of their family's income. We are going to explore one factor, that is the local availability of Head Start, that could be playing a role in racial and ethnic differences in participation. I will provide an introduction and motivation for the research, and Erin Hardy will describe the data and the results. Next slide, please. So why examine neighborhood access to Head Start as a possible factor related to Head Start participation? Stephanie showed that family poverty rates are higher among Black and Hispanic children. We're going to see in the presentation that in addition to higher family poverty rates, Black and Hispanic children are more likely to live in neighborhoods with challenges such as high neighborhood poverty rates. This means that the presence of neighborhood resources such as early childhood education, which can help compensate for adversity such as family and neighborhood poverty, are particularly important for Black and Hispanic children. An important national study that came out in 2009 found that neighborhood availability of Head Start impacts participation. For immigrant children in particular, having a Head Start center in their immediate neighborhood increased the likelihood of participating in Head Start, and the effects were sizable. The study found that impacts were largest for recent immigrants and for immigrant families that lacked access to private transportation. The presence of Head Start Center in their neighborhood made immigrant families more likely to know about the program and therefore use it, and also more likely to be able to get there since it was nearby. This is all consistent with research that suggests that immigrants rely more heavily than other groups on resources available in their immediate neighborhood. About 1/3 of low-income children live in immigrant families. Among low-income Hispanic children, about 2/3 live in immigrant families. This means that neighborhood presence of early childhood education is likely to be more important as a determinant of access to early childhood education for Hispanic children, and also for Asian children, because the majority of them live in immigrant families as well. Next slide, please. Motivated by the study that I just summarized, we wanted to know at the population level for all Head Start income eligible children, how does neighborhood level access to Head Start look like? In order to do this, we stepped through a series of questions. First, we look at where income-eligible children live and how this varies by race, ethnicity, and nativity. Second, we look at where Head Start centers are located. And finally, we intersected the two to understand whether Head Start centers are equally available at the neighborhood level to all eligible children of different race, ethnicity, and nativity. Next slide, please. First, we need to think about the location or residential patterns of income-eligible children. So we consider what we know about where young, low-income children in the U.S. live and how this varies by race and ethnicity. 2/3 of young children in the U.S. live in the 100 largest metropolitan areas. Minority children are even more likely to live in the 100 largest metros. Roughly 75% of Black, Hispanic, and Asian children live in large metros. Children in large metros also tend to experience very high levels of residential segregation. This means that minority children not only live in different neighborhoods than white children, but also live in neighborhoods with different resources than white children. It's a common misconception that racial residential segregation is just due to differences in family income. However, our research has found that even among low-income children, there are clear differences by race and ethnicity in the type of neighborhoods where children live. Across the 100 largest metropolitan areas, poor Black and Hispanic children are more likely than white children to live in neighborhoods with more challenges, such as high neighborhood poverty, and with fewer resources, such as access to parks and open spaces. So there is a highly segregated pattern in how low-income children are located and how, therefore, Head Start income-eligible children are located by race, ethnicity across neighborhoods in our metropolitan areas. Next slide, please. Let's look more closely at racial and ethnic differences in the neighborhoods of low-income children. This is important for thinking about neighborhood access to Head Start and other resources that can potentially be protective in the presence of family and neighborhood socioeconomic adversity. We will show 3 different neighborhood characteristics of low-income children in the 100 largest metropolitan areas. First, here we show neighborhood poverty rates. We see that low-income Black and Hispanic children face much higher rates of neighborhood poverty concentration than other low-income children. Next slide, please. Here we see that Hispanic children live in neighborhoods with a higher proportion of households with children, which potentially means neighborhoods with more demand for early childhood education. Next slide. And here we see that Hispanic and Asian children live in neighborhoods with more immigrants, which, as we mentioned before, are more likely to rely on resources available in their immediate neighborhood. This, again, may suggest more demand for early childhood education at the neighborhood level. Next slide, please. So some takeaways and background for thinking about the location of Head Start children based on what we know about children in metropolitan areas. First, depending on their race and ethnicity, low-income children and therefore Head Start income-eligible children live in very different neighborhoods. On average, Hispanic children live in neighborhoods with higher poverty concentration and higher concentrations of children and higher concentration of immigrants than other children. These patterns together are important because they suggest that Head Start eligible children who are Hispanic may live in neighborhoods with higher demand or need for Head Start than other low-income children. I'm going to turn it to Erin now to summarize the results of our analysis of neighborhood access, where we intersect the location of income-eligible Head Start children with the location of Head Start centers.
Thanks, Dolores. Good afternoon. This is Erin Hardy. So I will now take you through the results of our analysis of neighborhood availability of Head Start. Next slide, please. In this analysis, we look at 2 measures that capture different dimensions of neighborhood access to Head Start. So the first measure is the most basic, and it speaks really to the proximity or neighborhood presence of Head Start centers. So we look at the share of estimated eligible Head Start children who have a Head Start center in their immediate neighborhood. We look at eligible children overall, and then we look by race, ethnicity, and nativity. The second measure adjusts for potential neighborhood demand for Head Start and gives us an initial indication of Head Start availability at the neighborhood level. As Dolores established, potential neighborhood demand for Head Start is an important dimension of access to consider. So the second measure looks at the number of Head Start eligible children per center in the neighborhood of the average eligible white, Black, Hispanic, or immigrant child. While we're not capturing all dimensions of access, we consider these to be two important minimally sufficient dimensions of access to consider as a starting point. Next slide, please. A quick overview of data and definitions. We estimate Head Start income eligible children by combining data from the 2010 decennial census and American Community Survey's 5-year estimates from 2008 to 2012. The locations of centers come from the Office of Head Start, so we have the actual location and address of every center in the U.S. And we're using census tracts as a proxy for neighborhoods for this analysis. So this is a standard proxy used for neighborhoods. It's also the neighborhood definition that was used in the important national study in 2009 that Dolores mentioned that really motivated our analysis, so we wanted to be consistent with that as well. The analysis includes all children eligible for Head Start in all 50 states and DC, and includes all census tracts in the country. That's over 70,000 census tracts. We focus this analysis on Head Start preschool locations, so we are not including early Head Start and migrant and seasonal Head Start programs. And we're focusing on Head Start income eligible children, so we're notably excluding children who may be otherwise eligible for Head Start. So we define income eligible Head Start children for purposes of this analysis as 3- and 4-year-olds with family incomes below 100% of the federal poverty line. Next slide, please. Next slide, please. Thank you. So here we show the share of Head Start eligible children with a Head Start center in their immediate neighborhood by race ethnicity. So roughly 30% of children overall, and in most groups, have a Head Start center in their immediate neighborhood. There are no major racial and ethnic differences observed, except for Asian children who are noticeably less likely to have a center in their neighborhood. Next slide. Here we show the share of Head Start eligible children with a Head Start center in their neighborhood by parent nativity. So again, we see roughly 30% of children in both groups have a Head Start center in their immediate neighborhood. So there are no major differences by parent nativity. In other words, eligible children of foreign-born parents and of native-born parents are roughly equally likely to have a Head Start center in their immediate neighborhood. So it's important to note that the measure I just showed on the last two slides does not account for potential neighborhood demand for Head Start. So I'll now show results using the second measure of neighborhood availability that is in fact demand adjusted. Next slide, please. Here we show the average number of eligible children per Head Start center in eligible children's neighborhoods by race ethnicity. So here's how to interpret this. The average white Head Start eligible child lives in a neighborhood with 53 eligible children per Head Start center. The average Hispanic Head Start eligible child lives in a neighborhood with 83 eligible children per Head Start center. So Hispanic children live in neighborhoods with roughly 30 more Head Start eligible children per center. Now nationally, the average Head Start center serves anywhere between 30 and 50 children, but it varies greatly neighborhood to neighborhood and center to center. So a difference of 30 eligible children at the neighborhood level may amount in some neighborhoods to a 1 center gap in neighborhood availability of Head Start between white and Hispanic children, but of course depends on the size and capacity of Head Start centers in the neighborhood. Next slide, please. Here we show the child to center ratios by parent nativity, and we see that immigrant children, out of all of the groups reported, along with Hispanic children, have the highest child to center ratios, 83 eligible children per center. And the ratio is higher than that for non-immigrant children by 20. Next slide, please. So what have we learned? Measures matter when studying neighborhood availability of Head Start. So it's very important to adjust for potential demand for Head Start. Once we adjust for potential demand, these results suggest that immigrant and Hispanic children may have more constrained neighborhood access. This is unsettling given the research suggesting that neighborhood availability is perhaps most important for these groups of children. It also appears that the differences are real and could equate to a 1 center gap or more in some neighborhoods. It's important to note that these findings are reporting what's happening on the average, but of course it will vary place to place, neighborhood to neighborhood. So while the average is very useful to understand the patterns and potential scope of the issue overall, we urge policymakers to look and think locally when using these types of data to move towards solutions. State-specific results were not discussed, but there's a lot of variation in how these patterns play out by race, ethnicity, and nativity across the United States. So we urge you to utilize our neighborhood indicators that we have summarized for the 50 states and DC that are available on the diversitydatakids.org website. Next slide, please. Then finally, a few policy implications, but this is really just a start. The location of centers is an important factor to consider in efforts to expand Head Start and other early childhood programs. And we now have the data and methods to more systematically examine disparities in neighborhood access. As Stephanie from CLASP was explaining earlier, Head Start has a successful track record for reaching underserved groups. So we think that the Office of Head Start and other early childhood policymakers can use these types of data and analyses to identify the areas of greatest need and to target resources and strategies. One data collection recommendation, a limitation to doing more detailed analysis that compares local Head Start need and local Head Start usage, is the collection and reporting of Head Start center-level data. So Head Start Program Information Report data, which is what we currently have available, it aggregates the data from various centers up to what's called the Head Start program level. Programs can contain many centers. For example, Boston's largest Head Start program aggregates data from over 20 centers that span the entire city of Boston and serve children of diverse family backgrounds in terms of race, ethnicity, and nativity. Finally, sustainable solutions to effectively reduce disparities in local access to Head Start and other types of early care and education programs will need to go beyond federal Head Start and early childhood policies. We'll need to connect with other policy efforts that, in fact, shape local access issues as well, so economic and labor policies and housing policies, and need to connect with efforts that focus in particular on Hispanic and immigrant children and families. And we look forward to hearing Sylvia Puente's thoughts on this. Next slide. Please visit our website, diversitydatakids.org. We have neighborhood Head Start indicators summarized for all of the states and District of Columbia. And we'd ask that you join our mailing list. We will be sending out the research brief that summarizes these analyses early next year. Next slide. Yes. And now I'll turn it over to Sylvia Puente.
Hello, everybody. This is Sylvia, and let me thank CLASP and Diversity Data Kids, as well as Stephanie, Dolores, and Erin for the opportunity to comment. Really appreciate this. So for those of you that may not know the Latino Policy Forum, next slide, please. We're a small nonprofit organization located in Chicago, Illinois. Our goals are to improve early education outcomes with a focus on early education, but we also are a multi-issue organization advocating for affordable housing, promoting just immigration reform, and strengthening leadership with an understanding that advancing Latinas advances a shared future. So we're very involved in the Illinois policy arena with respect to early education and trying to prove access and quality for early education for our growing Latino community. But just to be frank, we don't have the opportunity to focus very much on Head Start policy because most of our policy efforts are really focused at the state level in Illinois as well as in the city of Chicago. And we have limited capacity to really conduct analysis at the statewide level. What makes our organizing model, I think, unique, though, is that it really is informed by local community organizations. We call it an acuerdo, which means accord, but it's basically a coalition of nearly 20 organizations that are the direct providers of early education, preschool, and Head Start in local communities throughout the state of Illinois. So our policy agenda is really driven by them, and the analysis that we do and how we work together in Illinois really comes from community-driven leadership. So that's by way of background. Next slide. So I wanted to share just a couple of things, and so these next slides are Illinois specific, but I think they're an example, and the general trends here are really applicable to other states, to the nation as well. So we were here looking at the change in low-income population, and this is all children under 18 because it's harder to find the data to break it out in the birth to 5 or 6 cohort. But here in Illinois, you can see that between these two time periods, between 2005 and 2014, we've seen substantial increase in the number of low-income Latino children in the state of Illinois, while other populations are remaining stable or declining. And I think this trend, given what we know about demographic growth across the nation, is true in many, many other states as well. So again, the need for increased demand is evident. Next slide. And we see obviously large concentrations of low-income status. In Illinois, we've seen the growth in low-income, the number of children, the percentage of children and the concentration of children who are low-income across all racial and ethnic groups, at 67% of African American children and 60% of Latino children in our state of Illinois. And again, I think the inference and this trend is applicable in a lot of other states nationwide, given what we know about just growing economic disparity in the nation as a whole. Next slide. And here, though, I think is what's interesting and really might be something we can discuss in questions given the data that we just heard about geographic location and is there neighborhood access for early education. While some of the data that we just saw that was provided by our other presenters says that most Latinos and African Americans live in urban centers, what we know about the low-income population in the state of Illinois is that 30% live in Chicago, 36% are in the suburbs or in the broader metropolitan area, and 35% live downstate. And in Illinois, that's primarily rural areas or much smaller communities than obviously Chicago or the Chicago suburbs. Next slide. But the distribution of that low-income population, and here we were able to focus on 5 and under, is substantially different for the Latino community. 35% are in Chicago, 11% are downstate, but 54% are in the suburbs. And I think this slide has real implications for how we think about access and place matters, and just really underscores the importance of what we heard from our earlier presenters on is there neighborhood access. I would love to see, and my question for the colleagues from diversity data is, can you break out the analysis that you just shared with us by literally central cities, large urban cities, or such as Chicago versus the rest of the region? Because part of my assumption is that we're going to see that there's a lot more neighborhood access and the numbers may even be lower in the city of Chicago versus the suburbs. And I think as we begin to look at sort of what are some of the solutions and how do we begin to address this, I think that we know that services can only be provided if there is an organization there to fill out the grant application and to provide them. And we know that certainly in Illinois and in the Chicago region, most of our organizations that work and serve and provide Head Start services are located in Chicago, but all the demographic growth has been outside of the city, and there is a real dearth of organizations, a real lack of capacity in organizations who are even capable of applying to provide Head Start or child care outside of the Chicago region. So we can't even begin to address some of the gaps that we've talked about if there aren't providers that are in these communities that have the technology, know-how, sophistication, practice, or even exist to be able to apply, to be able to provide the services that we're talking about today. So that's sort of one issue, is just the basic capacity issue, especially in areas of new Latino growth. And while clearly I'm highlighting the Illinois example here, I think that capacity issue is a real concern, especially in the states of new Latino and new immigrant growth, which are those southeast states that we saw that have very limited capacity, in one of our early states, in one of the earlier slides that was presented today. So the areas of new destination of Latino demographic growth are the areas where I think we're going to see the biggest gaps and greatest needs. Having said that, though, I want to say that our experience in talking to our providers is if the centers are there, Latino families will come. As long as they understand that there is an opportunity for their children to get educated and that this is going to help their children, our experience is that they will come. So it's really important, I think, to have the access. But on top of having centers and facilities in areas of new Latino growth, it's also very important that states and even as we work with the region's Head Start offices, really do that broad analysis to say where is the need, where is the growth, where is the need, and then how do we make sure that we're dispersing slots to be consistent where growth and need and poverty is for both child care and Head Start. And I don't know that that always happens. I know that for a long time in the city of Chicago, Head Start slots were given to X number of organizations, and despite consistent and profound Latino demographic growth, slots were only being allocated to Latino communities when slots became available. There was never the systemic analysis to really understand where the need was and be very intentional about making sure that slots were available in the areas of new growth and new communities. And I would wonder to what extent that same trend is consistent in other states. Let me, because I know my time is almost up, let me just say that in order to do this, though, one of the things that we find in our work is to have eligible families enter into both Head Start and child care, they must know that these programs exist. So there must be consistent plans and intentional outreach, and that outreach must be linguistically and culturally diverse, especially when we're speaking to immigrant families who may not be familiar with the system. And that in order to have quality in these issue areas, we really need to make sure that we have a bilingual, bicultural, and culturally competent workforce. And we know that in Illinois, we have a real shortage in the workforce in many of these areas. And one of the forum's initiatives is to really how do we strengthen a bilingual and bicultural workforce. And lastly, I'll just end by saying that obviously the gaps exist, and we see that they're highest in the Latino community. We know that we're entering a new federal environment, and there is certainly a lot of fear in the immigrant community, given what we're hearing, some of the policy proposals and shifts maybe in Washington, D.C. And that fear, I think, is also going to restrict potential access for even eligible families to apply for child care and Head Start. We're already hearing stories of young children going into some of our centers in the city the week after the election crying, feeling that as soon as they came home that their parents would no longer be there. So on top of all the other issues that we've discussed today, we have the very real threat of what this new administration's immigration policy might be and the intersection of how that impacts both access to this growing sector of the nation's population. And I'll end with that.
Wonderful. Thank you so much, Sylvia, for providing us with that overview of your work and what's happening in Chicago and in Illinois. At this time, we would really love to take questions from the audience for as long as our remaining 10 minutes will allow. I know we've already received a large number of questions, and you can submit additional questions through the chat box function on the webinar, and we'll try to get to as many as we can. But since we likely won't be able to get to all of them today, we also wanted to provide you with our contact information if you go to the next slide, so that you can follow up with us following the webinar. And also, if you've already submitted a question, we would be glad to follow up with you ourselves. So a first question, just a quick, I think, methodological question for the folks at Diversity Data Kids. Do you separate the numbers out by documented children versus non-documented children in your analysis?
No, we do not. And it is due to data limitations. We're using data to estimate who eligible children are and where they live using American Community Survey data. And so there is not information in that survey that gives us information about documentation status.
Great, and we just had a number of questions about Sylvia, though. It's important, I think, though, to say that we know that over 90 and 95% of children, immigrant children in the United States, or children who come from immigrant families are in fact U.S. citizens.
Right, that's a very important point. Thanks for chiming in on that piece, Sylvia. There were a number of questions also about whether the slides and the recording of the webinar will be available following the webinar, and it indeed will be available in the coming days on both the CLASP website and the Diversity Data Kits website, so you can access both the slides and the recording following the presentation in the next few days. Another question came in early in the webinar about the fact that access doesn't necessarily equate to quality, and that this is especially pronounced for Black children. And the person with the question was wondering if there was a future companion piece about access and quality, and subsequently about outcomes. And I can answer this from class perspective, and then I'll let the other folks answer from their perspectives. We aren't currently working on any companion pieces related to quality. I'll just say that quality is very hard to measure, and you know, has many dynamic variables as part of it. So it's sometimes difficult to be able to measure something like that. I'll just add additionally that there's a lot of research that shows that children just having access to childcare improves outcomes and stability, and also allows their parents to go to work. I'll pass it over to Diversity Data Kits next.
Hi, yes. We do have a sort of parallel set of indicators on our website. This is Erin from diversitydatakids.org. That is looking at, similarly, neighborhood level access to quality early childhood education centers at the neighborhood level. The distinction is that it's broader than Head Start. So our universe of eligible children is all children under 5, and then our programs include Head Start programs, but also include other center-based early childhood education programs. So, and those indicators are available for the 100 largest metropolitan areas through our website. But obviously agree with what Stephanie said, that quality measures have limitations, especially getting consistent quality measures for different types of programs across places in the U.S. The measures that we're using for quality, the markers we're using, is the NAEYC, so the National Association for the Education of Young Children. That is only, as again, to just agree with Stephanie, it's one marker of quality. It's not the end-all, be-all. So, and there's lots of information on our website about that measure, its limitations, and also, you know, some of the benefits of using that to be able to compare across places.
Great. And Sylvia, this is a question for you. Could you talk a little bit more about the work of your organization in increasing access to early childhood education and other safety net programs for low-income children?
Sure. So basically, Latino Policy Forum, we have a small education policy shop, and we are just very involved and embedded in the state's early learning system. So we will, as everything from participating in our Early Learning Council, all of the committees of our Early Learning Council. We're going to have a re-competition for Preschool for All in the next year in Illinois. So we will be doing the analysis on what would equity look like if we were to have equitable enrollment of Latino children in early education. We'll do the analysis of where those slots should be, as I mentioned, the city, the suburbs, and other parts of the state, and then closely working with our state officials to make sure that the criteria in that RFP really reflects the geographic need, but also make sure that there's accountability measures for things like linguistic and cultural diversity. So as a small policy organization, we're fairly unique. We know that. We just recently completed a strategic planning process. But really, it's making sure that we have relationships and membership with our provider community that serves Latino children, so we can hear directly from them the policy concerns, and then developing collective, being able to conduct the analysis to say what is equality and what should it look like, and then again working with our community leadership to develop and implement effective advocacy strategies. We also do a fair amount of parent engagement training, and then also work with parent leaders so that they can also participate in the policymaking process and bringing them to our state capitol to advocate on their own behalf.
Great, thank you. Another question that came in through the chat. I applaud both of these exciting efforts as they both address important questions of equitable access to important early childhood education programs. However, given that each is looking at only one or two of the publicly funded early child education options available in different communities, it doesn't take into account the other potential options that may be serving children, such as the growing state pre-K programs, TANF-funded childcare, among others. In some communities, these other programs currently are serving sizable numbers of children. Thus, are the resulting conclusions a bit overstated if not all the care options are being accounted for? Erin or Dolores, do you want to take the first answer on this?
Sure. A very good point, and we absolutely acknowledge that, for example, the Head Start analysis is one slice. As we all know, the early childhood care and education landscape is very broad and diverse. There are programs that are publicly funded, privately funded. Low-income families are accessing programs through various mechanisms, including subsidies. I will say that the neighborhood indicators that we referred to earlier that are for all early childhood education and that look at quality, those consider all of the early childhood education programs, including state pre-K programs, public and private pre-Ks as well. So those indicators try to go broad and capture everything. What you lose when you try to go broad and capture everything is that you can't hone into certain groups, and I think that's a very important thing, especially if you're looking at issues of racial and ethnic equity. Access to programs can be very different depending on whether we're talking about babies and toddlers or preschoolers. So some of the data constraints require us, when we try to go broader in terms of programs, our universe gets broader. We gain some information, but at the same time we lose some information. So it's a point very well taken, and we're trying to do more customized analyses in places where we have the data, both on the eligible child population and on the program side. So in Massachusetts, we're able to do that. We have a child care research partnership grant in the state, and so we're able to more carefully parse both the eligible child population and the programs to get those age cuts that we want and also the program cuts that we want. But it's a point well taken. We're continuing to try to move forward on the data, and I would encourage that person to take a look at the early childhood education indicators that we have on the site.
Great, and I'll just add two things to that. We also recognize at CLASP, of course, that there are other early childhood programs, but also that those programs are limited as well. Pre-K, of course, is only reaching 4-year-olds and in some cases 3-year-olds in most states. So yes, it's covering those people who would also be eligible for the Head Start population, but it's not covering the large range of other children who need access to child care and early education services. And the other example given in the question was related to TANF funding. And TANF funding does exist for child care, but it's a very, very small proportion of the dollars allocated to child care subsidies. So it doesn't have that big of a reach. So childcare, CCDBG and Head Start are really the largest federally funded early care and education programs. And then just secondly, of course, we're limited by the data available. We did initially look into whether or not we could do access to pre-K, but the data was so inconsistent across states that it was just impossible to be able to include that in our analysis as well. So with that, we have just 1 minute left. So if I might ask each of the presenters to give us one thing that advocates in states might be able to do to better understand racial disparities in their states. If you could suggest one thing that they might do, what might it be? Sylvia, you first.
Sure. Well, I think it's certainly be in communication with state and local officials to determine what this level of equality or inequality looks like in each of their states. And then obviously, given the challenging times we're living in, there's always a continued need to be able to do advocacy for funding, to improve funding. And then, of course, we want certainly more access, but we can't have access without ensuring that it's quality access. So then working through the appropriate systems in each state to figure out what those measures of quality are, especially with respect to linguistic and cultural diversity, to have more Latino enrollment.
And diversity data kits?
I'd say that it's important for policymakers to be able to understand neighborhood access in a better way, especially in relation to demographic change. Sylvia alluded to a very important issue, which is the increasing suburbanization of minorities and poverty. So we know that those areas have historically not been reached in services and programs for low-income families. But the landscape is changing very rapidly, so I think that we need to pay more attention to geography and changing demographics together.
Great, and I'll just add that it's great for advocates to be able to access state-level data if it's available to them and assess policies for programs like childcare in their state to see how they're impacting the different race and ethnicity groups in the state, and also to just build stakeholder groups and relationships with partners in, the civil rights community and the immigrants' right community to work together to assess some of these things. So thank you again to our presenters for being on our webinar today, and thank you to all of you for joining us. As a reminder, the recording of the webinar will be made available on our website in the coming days. And thank you again. Happy holidays to all of you.
Thank you, everybody. Happy holidays.
Thank you.